In these next videos, we're going to talk about medical emergencies that can happen in the dental practice related to the heart. The first one we're going to talk about is angina or angina. This is a condition of chest pain that's being caused by the coronary artery of the heart not being able to supply enough oxygen to the tissues of the heart. Angina can either be stable or unstable. Stable angina refers to chest pain that has a known trigger, whether it's exercise or stress. Unstable angina does not have a known trigger and it's a lot less predictable. This could be a good question during a medical history to find out if theirs is caused by exercise, stress, or it's unpredictable. This can help alert providers of the risk level of having a medical emergency and chest pain while they're in the chair. Ischemia is a term that we use when we say tissues don't have enough oxygen. Fortunately, in angina, this ischemia is not leading to tissue damage, so there's no necrosis that's resulting from the ischemia. The emergency drugs we should have on hand for angina are nitroglycerin and aspirin. Nitroglycerin can come in two different forms. We can have it as a tablet form, such as Niostat, or we can have it as a pump spray, such as this nitroglycerin lingual spray. Prime the bottle according to the instructions and do not shake the bottle. In speaking with a pharmacist, I asked what was the difference between the two. First off, there's a big price difference between the two, and most patients, to treat their own angina, are given the nitro tablets. And many of your patients, if they have this condition, will already be carrying this medicine on them. If they have their own nitroglycerin, that's the medication we want them to use. If a patient is complaining of chest pain and doesn't have a known medical history of angina, we can start off in addressing their complaint with nitroglycerin. If you're using the lingual spray, you're going to spray one spray underneath the tongue. If you're using the Nitrostat tablet, you're going to place one tablet under the tongue. Wait 5 minutes. If there's no relief, we're going to give a second dose. For the second dose, you're going to repeat either the one spray or the one tablet under the tongue and wait for another 5 minutes. If after 2 doses, they're still having chest pain, we're going to give the nitroglycerin one more time, but this time we're also going to give aspirin. For aspirin, you want to have chewable aspirin so it gets into the blood really quickly. This one comes in a nice orange flavor. You're going to give them 4 of the baby or low dose aspirin tablets. A way to remember this is the heart has 4 chambers. We're going to give them a tablet for each one of those chambers. And that's for your 81 milligram low dose aspirin. This is usually the kind that's chewable. The reason that we give the aspirin on the 3rd dose is because now we don't assume that it's just ischemia without necrosis, but actually some kind of tissue damage could be taking place. This means that it would be a heart attack. And aspirin is part of our medical response for a heart attack. And at this point, we also want to go ahead and call 911 and activate the EMS response. The way nitroglycerin works is it's a vasodilator for the coronary artery. Since we know the heart's not receiving enough oxygen, oxygen administration is going to be part of our response. The full mask with the portable oxygen tank is preferred. Even with that first dose of nitroglycerin, you should go ahead and start monitoring vital signs and filling out the emergency log. Any medical emergency involving the heart can be very unnerving for both the provider and the patient. Remember to stay calm and be reassuring throughout the response to the emergency. After the patient is dismissed, don't forget to put these notes in your clinical record.